You might have seen the segment on John Oliver's show about the dangers of med spas.
Med spa treatments have become so ubiquitous that, as one expert put it, they've been trivialized to the point that patients no longer see it as healthcare. But the fact is, some of the procedures do carry the risks of traditional medical care. And while many med spas are safe and staffed by careful professionals, the rapid rise of med spas has also been accompanied by a rapid rise in stories like this.
So I want to clarify a few important things so that you know how to be as safe as possible and you're not, being scared of getting in-office treatments. The first one is that credentials are super important. So depending on the state that you're in, the practitioner doing the treatment may not necessarily know how to operate that device or how to manage complications, which arguably the second one is more important. So in places like Texas, estheticians can inject and they can also fire lasers. And while a lot of them are trained very, very well, some of them may not be used to managing complications as well as a doctor or nurse who is trained and has seen these more often. That's not to say that they aren't good at what they do. It's just a very different educational standard. That's a fact and that's what it is. In California, where I am, that is not the case. You do have to be an RN, an NP, or a physician to fire these devices or inject. And again, the major thing is that if and when there's a complication, because these things happen, being able to identify what it is and how to manage it is the most important thing. So when you're paying for these treatments, you're paying for both safety and efficacy of them. Remember, they're medical treatments. The other part is that medical spas make it sound like it is this luxurious, nice going in and getting a massage type treatment. That's not what this is, right? We have commoditized them, but these are medical treatments. At the end of the day, they have very real risks, and you should know the person that's doing these treatments, their credentials, and the reputability of that practice, which is also important. And the last part is that the rules and regulations for med spas are quite lax nationwide. It means that there doesn't always have to be a physician present when you're doing when these treatments are being done. It means that sometimes there isn't even a physician in the office ever, which is also fine depending on the business. But the important thing is that you should be comfortable when you get these treatments and know what exactly is being done. And remember that if you aren't comfortable with a particular person doing the treatment on you because you want to know what their credentials are, ask. It's your face, it's your body, and you're going in and paying money for these things. Let me know if you have questions in the comments.